So this is one case in under 2 minutes. A 15-year-old soccer player was injured during the game, suffering acute right hip pain, and it was localised to the inguinal ligament and the ASIS. So the referring physician was concerned that with the pain on hip adduction and flexion that there was a muscular tear, perhaps to sartorius or inguinal ligament. So here are the findings. We examined the ASIS, which is the attachment site for TFL, tensor fasciae latae, and also sartorius, a little more anterior to this image. But in both longitudinal images, you can see the apophysis is quite irregular, and this can be a normal finding because while the fusion at the apophysis occurs somewhere from 13 to 15 years, it doesn't actually complete until the age of 21. So given this was a non-tender site, we moved the examination onward to the sartorius, which you can see is quite normal in the large image on the right. And then looking at hip flexors, so the rectus femoris, direct head in the top left image, and the iliacus, which was normal also. In the comparison of the tender region, so this is a longitudinal ultrasound transducer over the iliac crest, you can see on the left image the abdominal wall muscles as they insert into the bone are echogenic, and this is acute hemorrhage, hemorrhagic appearance or interstitial hemorrhage. So in the transverse view of the same region, we can see the external oblique is normal, and then the innermost layer, which is transversus abdominis, appears thickened and also more echogenic, and the internal oblique is certainly abnormal when we compare it to the image on the right. So in this case, the finding was a grade 1 tear of both the internal oblique and the transverse abdominis without a true muscular defect. The external oblique was normal, and the sartorius, rectus abdominis, adductor group, and inguinal ligament were all normal in this examination.